When considering the difference between healthy self-confidence and narcissism, it's important to note that while both may involve a positive self-image, they differ significantly in their underlying characteristics and impact on one's life and relationships. Healthy self-confidence allows an individual to move from a place of self-focus to a place of focus on all involved. It involves being confident in oneself and one's abilities without letting insecurities hold one back. A person with healthy self-confidence can still pay attention to and care about other people. It is characterized by a belief in oneself and one's abilities, along with the humility to recognize limitations and the grace to learn from mistakes. Narcissism, on the other hand, is characterized by a grandiose sense of self-importance, a lack of empathy for others, a need for excessive admiration, and the belief that one is unique. It involves a false sense of grandeur, overinflated confidence, and a lack of acknowledgement of one's weaknesses. Narcissists have a predatory self-esteem, which is wrapped in a zero-sum mentality, where someone has to be worse off for them to be better off. Unlike healthy self-confidence, narcissism can lead to a toxic life if left untreated. In summary, healthy self-confidence allows for a positive self-image while still being considerate of others, whereas narcissism is characterized by a lack of empathy, excessive self-importance, and a need for admiration. Okay, now let me ask you these 3 example questions. Is this a narcissist or just confident? You decide. A person is applying for a new job. During the interview, they talk about their skills, experiences, and how they believe they can contribute to the company's success. Is this self-confidence or narcissism? This scenario demonstrates self-confidence. The individual is showcasing their belief in their abilities and their potential to add value to the company. They are not seeking excessive admiration or validation, but are instead presenting themselves positively and assertively. Pretty easy, huh? Let's try this one. In a group discussion, a person asserts that their ideas are the best based on their experience, giving examples of their achievements and positive outcomes to impress those around them. Is this self-confidence or narcissism? This scenario displays narcissistic behavior. The individual is exhibiting self-centeredness, a need for constant validation. Their focus is on seeking admiration and attention, rather than genuinely valuing the input of others. Okay, let's make this last one a bit tougher. A person excels in their career and is aware of their capabilities. They often take the lead on projects and share their ideas with conviction. However, they struggle to accept feedback that challenges their approach, often becoming defensive and dismissive of others' input. They believe that their methods are always the most effective and are resistant to considering alternative strategies. Is this self-confidence or narcissism? This scenario presents borderline self-confidence tipping into narcissism. While the individual demonstrates confidence in their abilities, their resistance to feedback and insistence on their own superiority reflect narcissistic tendencies. Their inability to consider alternative viewpoints and their need to assert dominance suggest a fragile self-esteem and a lack of genuine self-assuredness. If any of these scenarios sound familiar, hit the like button. Now let's take a quick look at what can be mistaken for narcissism. Narcissism can be mistaken for several other conditions or traits, leading to potential misdiagnoses or misunderstandings. Some of the factors that can be mistaken for narcissism include other underlying issues. Some individuals may exhibit narcissistic traits and behaviors without meeting the diagnostic criteria for NPD. These behaviors may stem from other underlying issues, such as substance use disorders, trauma responses, or low self-worth. It's essential to consider these factors when assessing narcissistic traits. Another is Asperger's disorder, characterized by self-centeredness, narrow interests, and impaired social and occupational interactions, which can be misdiagnosed as narcissistic personality disorder, NPD, due to overlapping behavioral patterns. However, it's important to note that Asperger's disorder is evident as early as age 3, while pathological narcissism cannot be safely diagnosed before early adolescence. One last question for you. Are you familiar with the top 10 manipulative words used by narcissists? You can check out this video to see if any of their words sound familiar. As we continue our series on narcissism, we encourage you to subscribe to learn the latest insights and strategies for dealing with challenging personalities. See you in our next video.